Hi, I'm Dr. Kivett, a board-certified plastic surgeon and dermatologist. Today I'd like to talk about melanoma of the skin. Melanoma is a cancer of the mole cells that are in the skin. Very interestingly, when we are all about the size of a grain of rice in our mother's womb, the spinal cord actually controls everything. The spinal cord sends out cells which are previously programmed to line up and then fuse and form nerves. But there's a lot of trash left over in the process. And that trash eventually becomes moles in various parts of the body, including the skin, the internal organs, the brain, everywhere. So when mole cells change, they change based on different factors concerning the malignancies, which we can talk about. Sun clearly makes a difference, but there are other hormonal factors as well. Genetics plays a part. And so if we look at mole cells being irregular, when a patient comes in, we focus on the 5 differentiating points of what we see on the skin. The beauty of the skin is that actually, as the largest organ of the body, we can really tell what we're looking at that moment. Sometimes biopsies need to be done, such as with a shave biopsy or a scraping under local anesthesia. For the most part, the 5 signs of changes with moles are the A through E rule. A is asymmetry, in other words, a lesion that's not balanced in its appearance. B is irregularity of the border. You can have a scalloped border or a smooth border. The smoother the border, the less potentially problematic the mole is. C, if there's more than one color, then that raises our hackles a bit about being concerned. D is having the lesion be the diameter of a pencil eraser. If it's greater than that, there's more concern. And then E is an evolving lesion. Unfortunately, with our new patients, we've never seen them before, so unless they have some kind of photographic evidence that moles have changed, or a trusted person in their family who have told them that their moles have changed, then we have no idea as to whether that factor plays a part. But if there's enough concerns about the appearance, it's very easy to do a biopsy, essentially painless, and so that's something for patients to be aware of. Mole cell cancers, unlike non-mole cell cancers, have a potentially more problem in terms of injury or mortality to a patient. So the earlier a person is seen for a lesion or a concern, even if it's just a family member egging them on, it's a good idea to get seen. You can have dermatologists who are experts in the skin, or other experienced doctors of general types who can usually know what to do. If there's any question, follow it up and make sure you get your concerns met. Now, when mole cells change, it's not like a light switch that goes from normal 1 minute to dangerous cancer another minute. There's a series of graded changes, and that's true for all cancers, and especially for melanoma. So if there are a few cells in a mole that are irregular, it may not be even visible to the experts. But as the number of mole cells change in the skin, then it's becoming clearer and clearer to the observer that something needs to be looked at. So the first thing that would be done, if there's any consideration for a problem, is to have a shave biopsy or a scraping or even a punch biopsy where a cylindrical vertical piece of skin, very small diameter, is removed and studied by a microscope specialist, which we call a pathologist. Years ago, many years ago, a Dr. Breslow compared changes, as did a Dr. Clark, changes in the skin with moles, and they used different classification systems to put what they call stages on mole irregularity. And so over time, we have put more objectivity into studying moles. In the old days, if a mole looked even mildly irregular, knowing that the endpoint of severe melanoma would be death, they would go ahead and just take an arm off of a kid with an unusual mole on the fingertip. Of course, those days have long gone past us. So now there's been a condensation in decision-making by really good bodies of people who study this intensely. And so we're finding that we're needing to remove less and less tissue, but in more of an intelligent way. Don Morton, a doctor at UCLA in Santa Monica, around the same time I was there in the late 1970s, really helped put some additional study and discipline into this. And so he helped determine that if certain moles were a little bit deeper in the skin than others, then there was value in studying a lymph node, which might be there as the sentinel, like you would in an army fort, receiving the outflow from the cells in the skin, having changes in it. And if that sentinel node had melanoma cell in the individual node, then there would be a return to take out all the nodes. And if in fact those nodes were all negative, then removal of that sentinel node was associated with a very high potential to having completely cured the melanoma. So in essence, the people that develop melanoma now are actually getting cured with more and more efficiency. About 90,000 or so people per year in the US have diagnoses of melanoma. Not die from melanoma, but just have a diagnosis of it. And so over time now, we're getting a lot of control over melanoma. Also, there's some exciting things going on with molecular genetics, where melanomas that were previously thought based on size, depth, location, and other factors were thought to be death sentences, now are being declared as not having a huge impact on a person's life. The contrary is also true, but less so. So if there's any concern about melanoma, please see your physician and pursue this in an important way. And so in the future, if we can help you with comments and questions, make suggestions to us, please. If you like what we talked about today, give us a thumbs up, click for notifications, and always, in order to have more videos, please consider subscribing. Thank you.